Now, Cote d'Ivoire has registered its first case of COVID-19. The country's Ministry of Health and Public Hygiene announced the patient is a 45-year-old Ivorian who recently stayed in Italy. It comes after Togo and Burkina Faso recorded cases. It now means all of Ghana's neighbors have confirmed cases of coronavirus. The Ivorian announcement coincides with the World Health Organization's declaration of COVID-19 as a global pandemic. WHO Chief Dr. Tedros Ghebreyesus said the number of cases outside China had increased 13-fold over the past 2 weeks.
Has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. Pandemic is not a word to use lightly or carelessly. It's a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and death. Describing the situation as a pandemic does not change WHO's assessment of the threat posed by the virus. It doesn't change what WHO is doing, and it doesn't change what countries should do. We have never before seen a pandemic sparked by a coronavirus. This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time. WHO has been in full response mode since we were notified of the first cases. And we have called every day for countries to take urgent and aggressive action. We have rung the alarm bell loud.
President Akufo-Addo is meanwhile scheduled to address the nation at 8 p.m. about the enhanced measures taken by the government of Ghana to contain any case of COVID-19 that is detected. We intend to break into the news to take that address live, so do stay tuned in. Now, also here at Joy News, we intend to continue with the education about what you should do to ensure that you limit your contacts as much as possible with the COVID-19 should it ever find its way into the country. And there are some posters put out by the WHO which we intend to share with you on what to do. It essentially has to do with keeping personal hygiene. It's about washing of hands and using sanitizer. So here's one. Should I avoid shaking hands because of the new coronavirus? It says, yes, respiratory viruses can be passed by shaking hands and touching your eyes, nose, and mouth. Greet people with a wave, a nod, or a bow instead. And the president has already talked about that. He spoke about that when during the anniversary parade, the 6th March anniversary, Independence anniversary parade, and he actually demonstrated it by refusing or declining to shake hands with the guests who showed up at the Kumasi Sports Stadium. Now, is wearing rubber gloves while out in public effective in preventing the new coronavirus infection? The answer is no. Regularly washing your bare hands offers more protection against catching COVID-19 than wearing rubber gloves. You can still pick up COVID-19 contamination on rubber gloves. If you then touch your face, the contamination goes from your glove to your face and can infect you.